Hello, everyone. Thank you very much for joining us. Well, June is Men's Health Month. It's a time to remind us men of the health issues that we face and what we can and need to do to take charge of our own health. Well, you may have heard and even noticed that we men are less likely than our wives and women in general to see a doctor or report symptoms to a healthcare provider. So, Men's Health Month is all about encouraging men, especially the men in your life, to take care of our bodies by eating right, exercising, and doing the things that will prevent disease. It's the time to heighten the awareness of preventable health problems and encourage early detection as well as treatment of diseases, including cancer, heart disease, and depression. Health experts say that one of the best ways to celebrate Men's Health Month is to make an appointment that you may have been putting off. Oftentimes that we men ignore the symptoms and we put off the doctor's appointments because we believe that we're fine. Well, is it time for you to schedule a test? Well, use Men's Health Month as an excuse to make that call and get that appointment on your calendar. Now, here's another option. Next week, Fox 10 is partnering again with the Franklin Primary Health Center. We'll be offering free PSA tests as well as other health screenings like blood pressure, glucose, and other tests as well. For more than 40 years, Franklin has provided accessible, affordable, quality, and comprehensive health services. Franklin is a private, nonprofit health center started by a group of concerned citizens who saw the need for quality health care in the community. Our guest today on Perspectives, Charles White. He is the Chief Executive Officer, CEO of Franklin Primary Health Center, Inc. Dr. Prince Usije. He is Franklin's Chief Medical Officer. And Ron Martin, a board member of the Franklin Primary Health Center, and Ron has a story to share with us as well. Well, after a quick break this morning, we'll talk with our guest about Men's Health Month, our upcoming free men's health screenings, including the PSA for prostate health, and how and why Franklin Primary Health Center is partnering again with Fox 10 to make this all happen for men all around the Gulf Coast area. Perspectives continues in just a moment. Welcome back. Today we're talking about men's health, and in fact this is Men's Health Month, a very important time for all of us men to be aware of some things that we should be facing challenge-wise, as well as taking care of ourselves better in many cases. We're talking this morning with Mr. Charles White. He is here. Mr. Ron Martin and Dr. Prince Usije. We thank you very much for being a part of this discussion. So important. We're going to talk about the event coming up as well, but let's look back and from what you observed in your years now in the healthcare industry, what is it about men that it's more difficult to get us into the health center than for the ladies?
Well, you're absolutely correct about that. In fact, I was looking at our statistics. The women come 3 to 4 times more often to the doctor. I mean, and the number of women that are there, that are in terms of the population, is 3 to 4 times more. We see about 45,000 patients a year,
right.
And so you can tell again, like 3 times that. Most of those patients, of course, are the women.
So maybe 1 out of 4 are men.
That's exactly right.
And why is that so difficult to get us into that environment?
Well, you know, first of all, it seems like we just feel like we just simply don't have the time.
Oh my goodness!
I just don't have time to go to the doctor. You know, I mean,
right.
and I'll be all right. You know, we have the feeling that basically that we're macho and
invincible.
Invincible. You know, this thing I'm gonna be fine. You know, and so whereas a lady, when something happens with her, they're going to go to the doctor right away. You know, and go check things out. You know,
immediate response.
The immediate response.
Oh my goodness.
We've delayed.
Well, let's hear from Dr. Usije and see what you've observed from medical practice, and what do the men tell you when they finally come?
Well, they don't think they need to go.
Okay.
And sometimes they say they're afraid of doctors. They're uncomfortable. And they have things to do. They have no symptoms. So they tend to wait and wait and wait. And those of them who happen to have very good spouses tend to be the ones who remind them to go see the doctor.
That is so true. We have probably all seen that among our grandparents and uncles and aunts and our parents too, where the encouragement by the female in that household makes a difference. Now, Ron, you have been an executive in a major corporation and worked with other agencies giving your time and energy and expertise. From your observations here in the last 20 years, what seems to be the reason why you can't get more of your friends to join you at the health center?
Well, I would have to say with what Mr. White said, a lot of it is ego. The other part is they don't have the time. I guess I was extremely fortunate in that I would go to the doctors, and that's when they found, you know, that I had a high PSA, and I was having to take different tests as a result. But I was taking that PSA test, but to try to get men to go, I equate it to this. If you have a car, and most men know that if we have something that we ride in, we're going to make it a point to make sure that our oil is changed and that sort of thing, because we want to prevent any breakdowns. Well, we have to do the same with our bodies. The most important thing that we have, the most important thing that we've been given is our body. And we have to do that. Now, in my particular case, they found that I had a tumor, which a tumor in the prostate is cancer, and mine was removed in 2001. My prostate was removed. So, and at the time I was told that, you know, you may have 5 or 6 years of life left after this. Well, as it turns out, that was in 2001.
Right.
This is 2024, and on August 20th of this year, it'll be 23 years.
Yes.
So you can live with it.
Right.
Now, in my particular case, they also did not get everything. So since that point in time, I've had 37 radiation treatments, which I guess it slowed it down, but didn't get it all. But I'm still extremely blessed. I had the support of family, friends, and particularly church members who I know are praying for me all the time.
And that makes a difference. Let me ask you, and you not only experienced that yourself, but if I remember correctly, didn't you have some relatives as well who you know that you lost to prostate cancer?
My father and my brother both passed as a result of prostate cancer. Yeah. I've had friends that have gone and taken my advice, and 2 of them did find that they had prostate cancer. But prostate cancer is such that at the early stages, you don't know that, you know, there are no symptoms or what have you.
You're not feeling anything.
That's right. Until it gets later. So in the process, what you need to do is make sure that you pay attention to your health. And early detection is the key.
That's the word that we use a lot, and that's what the events coming up are all about, early detection. Dr. UCJ, when you talk about prostate cancer, thank you, Ron, for bringing that into the discussion. You are, tell us some of the things that men should be aware of. Is it something that you can avoid by doing certain things, or we all are destined to have a bout with prostate cancer being men? What are you seeing?
Just being a man, you have a chance of having prostate cancer. Actually, I think CDC says that 1 in every 9 men would have prostate cancer in their lifetime. And that may vary depending on the ethnic group.
I was going to ask you that.
Because African American people tend to have higher incidences of prostate cancer.
Do they know why yet?
No, we don't know all the reasons, but genetic plays a role. Now, on the other hand, family history is important. If the dad or uncle or someone close to you, blood related, has prostate cancer, then the chance you do have the risk of having prostate cancer. That makes it a risk twice. Being a man is a risk. A family member is another risk. And other things, being older, at the age of 50, that also is a risk. However, there are usually no signs or symptoms. If we wait for us to have this sign that we may have prostate cancer, it's probably already too late. So, yes, early detection is important.
And so you're saying now 50 and older, we should definitely be taking advantage of these free screenings for the PSA.
Actually, yes. Okay. We say 50 and older for all men in general. Okay. Actually, we say much younger than that.
Right. Yes.
Maybe even 40 or older.
I know it's
for
been
those with high
changing.
Risk.
So
yes.
if you have those factors of where things have happened to other men in your family, especially as you mentioned, the father, the grandfather, and Ron, you said your father and
my
a brother.
Yes.
Brother.
So,
well, let me ask you this, Mr. White. We have about a couple of minutes here before we take a break. Why does Franklin partner with Fox 10 to do this, to make this happen? What is it that you feel is happening in the community that this needs to be a service rendered?
Well, first of all, let me say there's a tremendous need. Cancer is, number one, as one of the second leading cause of death, basically, period. But PSAs, like you said, prostate cancer is certainly very common among men, in particular African American men. And so we see that basically too many people are dying. Last year there were over 1,200 or so folks that actually died. 1,200 or something that actually had it, and 500 and something of them died. And it is a silent killer. So certainly we really see the need, and we really enjoy the partnership with you all that can get the word out, because we really want men to come in and this whole part of the thing that you said, to encourage the men to please come, and the wives and
bring them.
That's right. That's right. Yeah.
Because when that hits a family, it's not just that male who is the issue is not just with him.
That's correct.
Dealing with the problem, but it's going to affect whoever the immediate family is as well.
Yes,
and
that's exactly right.
If you have a husband or a father or grandfather who hasn't been doing the things that you think they need to be encouraged to do,
that's right.
We do encourage them to join us at the events. We're going to share that information when we come back from our break, as well as talk more about some of these challenges that men need to be aware of, and the other screenings as well that we should be taking advantage of. Our very special guest this morning talking about Men's Health Month. We'll have more here on Perspectives when we come back from a break in just a moment. Welcome back. Today's topic, Men's Health Month. And of course, we've got some free PSA tests and other health screenings taking place at the Fox 10 studio, as well as the Franklin Medical Mall, and in North Baldwin at the Franklin Center there too. That's right. So that we can hopefully reach every man in the viewing area who's hearing our voices today, as well as we've been marketing that to the community, to the public, because it's so important. Now, Dr. UCJ, when we were in the break, you mentioned that not only will you possibly die from prostate cancer, which those numbers have gone down for those who are getting treatment, but there's also a chance that you'll die with it because it affects a lot of men.
Yes, because it does affect a lot of men, and when taking appropriate care of yourself, either early detection or treatment, most people with prostate cancer will die with it, not of it.
Right.
And that's essentially the realistic goal, to get treatment on time and live out your life.
My grandfather was 74 when he died from prostate cancer, and that was back in the 70s. And at that time, there were very few options that doctors were having available at their hands to help either cure or comfort him. And so I got to see that as a teenager. And then my father, he was like Ron, a survivor of prostate cancer, and he had radiation seed implantation. So he had a different option that was available to him, and that would have been in the late 1900s. And so I'm thinking, wow, it sounds strange saying the late 1900s, but like somewhere in the 1998, 99, somewhere in that area. But that is one of the things that through organizations like Franklin and health clinics and having people like Dr. UCJ there, you have other options to offer men today.
Yeah, there are many options. First of all, again, getting tested. PSA is just a blood test. Doesn't require anything else, the blood test. Then, given on the number of the PSA, it can be monitored. If it is elevated and needs extra attention, then you can see the specialist. Now, if indeed at some point someone is found to have prostate cancer, there are very different options for treatment. Even before that, during the times you were talking about, in the late 90s or so, biopsies were pretty much blinded. But now they have so many more tools to actually focus and direct on the prostate, to assess the prostate, to assess whether or not there are cancer cells or where they might be, before even the specialists will go in and take a biopsy. So when they do so, they can get the actual sites that are suspected for malignancy.
So it's so important now to take advantage of these advances in technology. How comfortable were you, Ron, when you went in 23 years ago almost to address this and deal with this? Did they tell you you had a few options?
They did tell me I had options. And at that particular time, robotic surgery was just coming on board. So, but they told me I had options that I could do not the hormone therapy, but I could do the operation, or I could do the radiation, or the seed plantation, implantation. So I chose to do the operation. And because I had different options in doing that, with the operation, once my prostate was removed and found out that they did not get it all, I still had the option of getting radiation. And as a result, I ended up taking 37 radiation treatments. Still didn't get it all. But you know, you have other steps that you can take place.
Right. And I think the testimony to what you've gone through is evident in front of all of us today, because you are extremely healthy and you have been living your life. You went on beyond that point, so it's not a death sentence as some people once thought, Dr. CJ. Well, that's the PSA.
Yeah.
What else are you offering
Yes.
in screenings? Because there are other things that men need to be aware of.
Absolutely. In fact, the other things that we're screening as well are things that are top also killers of African American men, or men, period. And that is actually cardiovascular disease, a heart disease is #1. It's still the #1 killer. And of course, it's so simple. We just need to come by, and most of the time they can come by the office anytime almost and just get a blood pressure check. That's one of the things that to prevent, just check your blood pressure, you know, and because that's one of the things that leads to, of course, heart attacks and strokes. And so we're going to be testing, doing blood pressure, of course. We're also another leading killer, and it's like an epidemic here in Mobile, and that is, of course, diabetes.
That's right.
And so we are going to be testing for blood sugars. So we're doing free blood sugar tests for because, again, that's a terrible one, because people can wind up on kidney dialysis and things of that nature. They can lose their eyesight, become blind, and lose limbs and things of that nature in terms of that because of diabetes. And so it is.
Why is it so prevalent here in this part of the country?
Well, it's interesting you said that, because one of the things, we've been involved in a study, a National Health and Institute study, an NIH study, I should say, basically. And basically, we were actually involved in it. It's 86,000 people that were recruited into this program, a national cohort study. And they actually have said that basically they don't understand why is it that the testing to see, and we're part of that study right now, that basically more people in the South die basically from cancer than anywhere else in the country. And so they're actually, part of this study, what they've been doing, we take urine, we have taken saliva, we've taken blood, and they're actually becoming part of even a national death thing. They're looking at to see what are the causes, why are people, what are they dying from?
Now, the diabetes at one time, they were telling us about our diet having a high indicator for that. Is that still the case, or has it gotten?
Well, it's one of the things that's certainly diet that you indicate. I mean, and that's one of the things I want to say. We do have a nutritionist on board at Franklin too, so help us with, because you know, we historically we have all the food that we ate, you know, was high in salt, and of course, and we had other things.
A lot of times not by our choices initially.
That's right. That's exactly right. But yes, you're absolutely right. With that, diet, exercise is still the same things that we need in terms of that call, and that's one of the reasons why we're also doing BMIs. You know, we're again looking at basically the weight. And that's one of the things, because medications, we have those. That's one thing. I'm real proud that Franklin, we have pharmacists. We have 3 pharmacists there, and basically we have 2 pharmacies. And basically we do have the medications at the cheapest price you can ever get, so they can get on Ozempic or any of those medications that you need. But those are also weight loss.
And you've had physicians like Dr. UCJ, he is your chief medical officer, but he's been with you for more than a couple of years.
Yes, sir, I have. I'm so proud. And you're right, I have we have about 20, 25 board certified, a lot of board certified primary care physicians, and like Dr. UCJ, who's board certified in both internal medicine as well as geriatric care, so you can take care of senior citizens. So you're absolutely right. We have those. We've got about 18 or so certified nurse practitioners that are there, and that's the key. Is that basically we just want to encourage people, not just we're giving these free tests now. We're going to be, as you already indicated, at 2 locations on that Thursday. I think it is on the 6th, so where we will be basically at the Medical Mall, and also up in Baldwin County. We have 20 locations, though.
Basically, you know,
that's right. And
several counties that you serve.
That's right. And we do a lot of outreach work already as well. We have mobile units, 2 mobile units that are going around in the neighborhood. So I would also like for people to just look at the website, and you can see where, because we do free tests on those too. We're doing those blood pressure tests. We're doing blood sugar tests.
That makes a major difference, especially with the numbers that you shared earlier, that we're losing people.
That's right.
And very sad that we're losing that many, considering what's available to us these days.
That's right. That's right.
Dr. UCJ, close us out with a word to those who are watching today about taking advantage of this type of medical information, technology to encourage our men, especially this month, to come on out.
Yes. Again, do not wait for signs or symptoms. Even the blood pressure is also a silent killer. They will check your blood pressure and they get a number reading and they will give you advice. Then you can do what you need to do, see your doctor. You manage that with your doctor, with the help of your doctor, and get the blood pressure controlled. It is no crime to have blood pressure. It's no sin to have blood pressure. Nothing to regret. But once we have it, then we have to do the right thing to get it regulated. The same thing with diabetes. You did not commit any crime to have diabetes. You did not ask for it. And it's not just the diet, it's the genes too. Okay. So we may have the gene to have us predisposed. Now diet may make it come early. By the same means, check it out. If you do the appropriate management, the food, the medications, they have so many more now.
Get a point
to get your body treated.
Well, we will make sure that this message goes out.
All right. Yes, sir.
And that the men hopefully are watching today. And if not women, again, we encourage our wives to make sure we get there. Now, here's that information again that we were all talking about Thursday, June 6th at the Franklin Medical Mall and the North Baldwin. You can see there, right, Medical Center in Bay Minette.
That's right.
And then, of course, come to the station on Friday, June the 7th. We love to see you here. And, of course, not too many people wearing white jackets here, so you'll maybe feel a little more comfortable coming in. So please join us here. Have a great day. We'll see you next time.